Hi everyone, I'm Zion Torres, and today we'll be talking about sexual disorders, a category in psychology that includes various challenges people face in experiencing sexual health and satisfaction. We'll be going over definitions, DSM 5 categories, and some real life examples to better understand this complex area. What are sexual disorders? Sexual disorders can affect anyone regardless of age or gender and can deeply affect mental and emotional well being. These are not simply based off preference, they involve distress, dysfunction, or harm. The definition: sexual disorders refer to psychological conditions that impair sexual functioning, behavior, or desire. These are divided into two DSM 5 categories: sexual dysfunctions and paraphilic disorders. Category 1: Sexual dysfunctions. Sexual dysfunctions involve issues during the sexual response cycle, such as problems with desire, arousal, or even orgasm. For example, erectile disorder refers to ongoing difficulty maintaining an erection, while genital pelvic pain disorder involves discomfort or anxiety about penetration. Disorders listed: erectile disorder, female orgasmic disorder, male hypoactive sexual desire disorder, premature ejaculation, genital pelvic pain / penetration disorder. Category 2: Paraphilic disorders. Paraphilic disorders involve intense sexual interest in unusual objects or situations, especially when they cause harm or distress. It's important to note that not all paraphilias are disorders. They only become diagnosable when they involve non consenting individuals or interfere with life functioning. Some of the listed disorders are fetishistic disorder, pedophilic disorder, transvestic disorder, and sexual sadism. This short video gives a clear animated overview of the most common sexual disorders. It walks through symptoms, categories, and examples that help explain what we just covered in real life terms. There will be a description down below. What stood out the most to me was how common and treatable many of these disorders are, but people often feel too embarrassed to ask for help. I also found it very interesting that people can have an unusual interest and that it still not be considered a disorder unless it causes distress or harm. Here are a few review questions just to test our knowledge on some of the information we've went over thus far. Now, I have placed the answers on the screen just so that you can copy them down for later. To wrap up this presentation, I would like to highlight a few important takeaways about sexual disorders. Sexual disorders, whether they fall under sexual dysfunctions or paraphilic disorders, affect many people across all genders, ages, and backgrounds. What's important to understand is that these disorders are real medical and psychological issues, not just about sex, but about emotional, mental, and even physical well-being. Sexual dysfunctions like erectile disorder, orgasmic disorder, and genital pelvic pain can impact relationships, self-esteem, and quality of life. They're also more common than we think. For example, studies estimate that around 43% of women and 31% of men have experienced some form of sexual dysfunction at some point in their lives. On the other side, paraphilic disorders are more complex and can involve legal or ethical issues, especially when non-consenting individuals are involved. But it's important to note that not all paraphilias are classified as disorders. It only becomes a disorder when it causes harm, distress, or violates others' rights. The good news is that help is available. Treatments like cognitive behavioral therapy, sex therapy, medications, and even relationship counseling can lead to significant improvements. But it all starts with education and reducing stigma. So if there's one thing I hope you remember from this presentation is this: sexual disorders are more common than people think, and nobody should feel ashamed for seeking help. Talking about it openly is the first step to better understanding, treatment, and healing. Okay, now that I've wrapped up my presentation, this is my citations page. I hope you guys learned some things just like I did and enjoyed watching my presentation. Thank you so much for watching and have a wonderful day.